Welcome everyone, and thank you so much for joining us here today as we kick off Cambia Grove's 2021 Trails Competition. I am Julie Anderson, director here at Cambia Grove. I will be inviting our panelists to the stage momentarily, but first wanted to share a few opening comments and go over a few housekeeping items. At Cambia Grove, we serve as a catalyst to transform healthcare towards a more person-focused and economically sustainable system. We do this through collaboration with the 5 points of healthcare, which we define as patients, payers, providers, policymakers, and purchasers, as well as with other aligned stakeholders and innovators. Our goal is to drive transformation by optimizing 3 key elements of the healthcare ecosystem: infrastructure, incentives, and culture. As part of this work, we identified an opportunity to create direct pathways between startups and the traditional healthcare system to help foster a culture of innovation. We developed the concept behind the Trails competition to provide promising startups with the real-world application and feedback that is necessary for solutions to succeed. Winners of the Trails competition gain a better understanding of how their products can be developed and scaled to address critical challenges. This year's competition seeks solutions to challenges in behavioral health. And we have structured the competition this year a little differently to allow even more real-world access and exposure. Thank you to Providence Digital Innovation Group and MultiCare Behavioral Health Network for partnering with us to provide this year's grand prize. This year, the top 5 finalists will participate in a tour of the 5 points of healthcare, gathering real-world insights from a number of experts at the leading organizations that you see here on the screen. The top 5 finalists will then compete in a pitch competition for the grand prize. This year's grand prize winner will engage in a series of valuable informational interviews and workshops with strategy, clinical, operational, and venture partners at Providence and MultiCare. We are extremely excited about this prize and this opportunity. We are thrilled to host today's event to discuss the types of innovation that can best support behavioral health challenges and also to offer advice for Trails competition applicants. Samantha Clark and Julie McComish both represent our grand prize partners, and Gabe Howard will participate in the 5 points tour and as a judge to share a patient's perspective. Throughout the discussion today, please use the Q&A function located at the bottom of your screen to send your questions our way. We will have about 15 minutes at the end to get through as many of them as possible. Finally, as an FYI, this event is being recorded and will be made available after we wrap up today. Okay, it is now my pleasure to introduce our speakers for today's conversation. Samantha Clark, Gabe Howard, and Julie McComish, please turn on your videos and join me here on the virtual stage. So good to see all of you. Okay, we're thrilled to have each of you here today to help us kick off the Trails competition. Thank you again so much for joining. I'd like to start by asking each of you to just quickly introduce yourselves to our audience and tell us a little bit about why you're excited for this year's competition. I think we'll start with you, Gabe. Why don't you take us away?
Oh, well, thank you so much. Hello, everybody. My name is Gabe Howard, and I live with bipolar disorder. I'm a patient advocate, I'm a speaker, and I host the popular podcast Inside Mental Health, which is a podcast taking you inside mental health and mental illness and psychology, with the goal being to get high-level experts and celebrities and people that we can't normally talk to, talk about mental health in a way that my father can understand. I really truly believe that people are looking for information about mental health. They want to learn more about mental health, but they don't know what's good, what's bad, and they can't get access to the experts, the celebrities, or people with lived experience that they need. So thank you very much for having me. And any discussion, innovation, anything to do with mental health, I think is amazing, because for the longest time, mental health was relegated to that thing that we whispers. So having a competition with the words mental health in it, like you could just stop right there and I'd be on board. But I know we're doing you're doing so much more than that, and we're doing so much more than that. So that just makes it even better. So that is my buy-in. Thank you for having me.
And thank you so much for participating. And thank you also to Patient Orator for helping to find you and locate you for this competition. Okay, so next on my screen is Samantha. Samantha, why don't you introduce yourself as well?
Hey folks, I'm Samantha. I work for MultiCare's Behavioral Health Network as Executive Director of Strategy and Business Development. The job that I have working for Washington State's largest behavioral health provider is a dream already, but getting to be in these spaces makes this work even more exciting. Many moons ago, I was a social worker. I started in health and community services working for foster kids and what's called behavioral rehabilitation services. And for those of you who have worked in behavioral health, you know that sometimes it's clunky and it's traditional, and innovation is not a word that you often find orbiting around our field. And so I'm really excited to be here to listen to your ideas, to coach and to guide, and just see our field grow.
Wonderful. Thank you so much, Samantha. We're so happy to have you part of this. Okay, next up, Julie, please introduce yourself as well.
Yeah, thanks so much. It's great to be here with all of you. Thanks for spending, whether it's your lunchtime or if you're in a different time zone, whatever time it is with us. I'm coming from Providence, which is a large health system based out of Seattle. We've got over 50 hospitals, over 1,000 health clinics, and 120,000 caregivers, so our, as we call them, employees. And we cover 7 different states. So we've got a lot of folks who need services. We've got a lot of work happening to help support our behavioral health. And specifically, I work with our Digital Innovation Group, which is an innovation hub within our health system that helps tackle some of the biggest problems that we have in healthcare. And I think as this conversation goes on, I think no one is disputing that behavioral health services are one of those kind of core areas that really needs a lot of work. So I'm so thrilled to be participating in this work and helping support innovation in the space.
Wonderful. Thank you so much, Julie, and also Gabe and Samantha. Okay, so we've got a number of questions to run through today that I will facilitate. And then, of course, as I mentioned earlier, we will have some time at the end for audience Q&A. So please do put your questions in the Q&A box at the bottom of the screen. So to start, I think it would be important for us to just level set. And my first question aims to do just that. So Samantha, we'll start with you for this one. And obviously Gabe and Julie chime in if there's anything to add. Samantha, when we talk about behavioral health, what exactly do we mean? What does this term encompass?
Thanks, Julie. So when we say behavioral health, it's really the unison and uniting of both mental health and all of the services that encompasses, and substance use. They have so much to do with our behaviors. And so when we use that term, we're just being more inclusive of both sides of those services. And when it comes to services, there's actually a really broad array in what we term behavioral health. So there's community-based services and wellness, kind of subclinical services. You also have outpatient or ambulatory services, and you could have services that are integrated into different environments, whether those are schools, primary care clinics, or skilled nursing facilities and other healthcare environments like that. And then as you get a little bit more intense in those services, you can have residential, inpatient, and then a menagerie of different services that are kind of like a hybrid, like intensive outpatient or partial hospitalization. So the field of behavioral health is actually quite broad. So there's a lot of room and opportunity to innovate in many of those spaces across that continuum.
Fantastic. Thank you so much, Samantha. Okay, so our next question, Gabe, will go to you to provide a patient's perspective. We'd love to hear about, obviously from your perspective personally, what are the areas of opportunity for improving the care of those living with behavioral health challenges?
I think this is what's so incredibly frustrating to me. The opportunity is so vast. I mean, it really is wide open. What people living with mental illness or addiction issues need are services. And right now, when I walk into any room, people are talking about like, okay, well, how do we get more beds? How do we get people help? How do we get people to participate in the process? And it always comes down to how do we pay for it? It always comes down to how can we pay for it? any sort of innovation that makes that less expensive, and I've got like a million ideas right off the top of my head, right? Any innovation that makes it more efficient to treat the patient, right? To treat me is going to be widely used. And I think there's just, again, I am not a hospital administrator. I don't claim to be, but sincerely, I really look at this as a business problem to be resolved. And I believe that it can be. And once that business problem is resolved, more people like me will get help. So frankly, I think the innovation is, I just think there's so much opportunity, and the majority of people don't realize it. Therefore, they're simply not looking for it. And honestly, that's like that's like a hard stop. Like it's just so obvious to me. I want like a better answer, right? Like, oh, what we need to do is understand the counterpinnings of the, no, like if anybody tries, I think you will be instantly successful. That is how low the fruit is hanging at the moment. Please, please try.
Yep, that's great. And that's why, I mean, we're obviously so thrilled to be focusing in this area through the Trails competition and are so excited to see what solutions and what applications come through. We just really are very excited about that and eager to see. So great. Yeah, thanks, Gabe. Okay, so this next question, Julie M., this will go to you. We'll start with you to share the digital innovation hospital system perspective. And then of course, Samantha and Gabe, please chime in with your perspectives as well. As innovators develop products that improve care or access to care, do you have any advice for them? What should they consider and what should they avoid?
So much advice. I'll try and keep it quick though. I mean, as Gabe mentioned, there's so much opportunity in this. How you approach it is really critical. So I'll talk about two things that I think are really things that you should definitely try to do, focus on. And then I'll also talk about a couple of common pitfalls that we see when we talk to companies. So the first two things that I think are really, really critical. The first is focus on the problem. Really talk to patients, talk to people with lived experience, talk to clinicians, learn what's not working, and focus on the nitty-gritty there. Often we see that innovators kind of gravitate towards cool solutions or maybe the tech that they want to build. And a lot of times that doesn't actually solve the need or fit into what the kind of care process or workflow might look like. So get to the heart of the problem, think about what you're really trying to address, and make sure that you've talked to a diverse group of people, whether those are patients, whether those are clinicians, to really get the learnings there. I think then and keep doing that, because as you go through the iterative process of building your company, of whether that's tech or services or whatever you're trying to do, make sure that you're constantly kind of staying towards that North Star. A second thing, and this is something that Gabe brought up and is, unfortunately what I have to think about every day, which is you have to focus on both the business and the operating model for your work to be successful. So how does this fit into existing care? If you're trying to do something separate, great, keep going. But if you're trying to align something, there's a lot of services that exist right now. Make sure that you are paying attention to how that fits into workflows, where this is going to go in the clinical workflow and that acuity spectrum that Samantha talked about. And then really, really, really work on how is this getting paid for? Who is going to pay for it? How and when are they going to pay for it? And what are the triggers that focus on that? If you're not able to solve those problems, that is really going to be one of the hardest parts. And I encourage you to get creative, because one of the things that has been a challenge is that we see a lot of innovation gravitating towards employers and to payers, which is needed and important because that's where a lot of the funding is. But coming up with creative ways to help support care providers, there's so much opportunity, and there is a lot of money in the space. There's a lot of opportunities there. So focusing on that is great. And then I'll just highlight a couple of pitfalls, which are maybe some of my common pet peeves, but things to really think about. One of them is that if you cannot articulate what your company can do, then it's not going to be successful. Partly this is frustrating because I got back from my first post-COVID conference and I talked to multiple vendors who, after 15 minutes of conversation, I cannot tell you what they're actually selling. If it takes me 15 minutes to understand, you haven't done a good enough job selling what you're doing. So really think about how you can clearly articulate something quickly. A second thing, and this is just the reality, is around the burden of proof for what you're trying to do. So around value, how are you actually going to show that your product works? Are you looking for clinical outcomes? Are you looking for cost outcomes? And until you're able to show those and demonstrate them, it's really hard to get into some of the larger health systems. So think about what kind of partnerships can you develop early on? How can you test it out? And really think about what you're trying to sell. Too many companies are trying to, they don't have a really clear sense of the value they're providing into the system. And if you can articulate that really clearly, prove it, then you're definitely going to have more success. So Samantha, Gabe, definitely interested in whether you've got some other thoughts, because I know tons of pitfalls here.
I would totally agree with everything that you shared. Common pitfalls that I've seen is lack of integration with our electronic health records, which, I mean, our EHRs are like the core of all data, functioning records, claims, et cetera. And so for us, that's like the lifeblood of our healthcare system. So if you've not put any thought into how your product is going to orbit or integrate with our EHR, that's probably an immediate no-go for us. Also, how your product interacts with other tools, resources, systems. The last several years, healthcare has done a lot of consolidation. We can't care for our communities alone. And so we partner. And so if your product is only meant to function on its own and you don't want to collaborate with others or create shared spaces, that's probably going to be a challenge for you in terms of growth. And just another easy way to think of your product and your consumers, whether that's your clients or people in services or your providers who are utilizing it, the fewer clicks, the fewer manual things, tasks people have to do, the better. Automate it as much as you can and create a streamlined, efficient product, because no one feels like they have the time in the day to do manual processes and, you know, take 10 more clicks, even if it's an awesome service. And that's just a reality that we find here in the industry.
I want to talk about like level setting. So many people believe that whatever it is they have is going to revolutionize the world, and that's great. I please think that way. Like I love the enthusiasm, but here's the part that you have to stop thinking about. It's not going to do it quickly. I really love analogies. I live in a little small town, really tiny, right next to a big town. So that's why I always say Central Ohio instead of Columbus. And I have a main street. It's really cool. It's a main street filled with old buildings. And there is this really cool space that like restaurant after restaurant after restaurant opened up in. 6 months later, went out of business and closed. And finally, a restaurant opened up and I was just like, okay, these people might be mentally ill, pun intended. So I asked the owner, I said, every restaurant that's opened up here has failed. Why would you open in this space? It's clearly cursed. And the owner, who is an exceptionally intelligent woman, said to me, because they all went out of business in 6 months. It takes 2 years for a restaurant to be profitable. So all of these other people who opened up a restaurant, they had no idea what they were doing. Therefore, the data is worthless. That very first restaurant that opened up might have made it if it had 2 years worth of operating capital. But because they didn't plan for that, I am going to take advantage of this space and be an institution in this neighborhood. And she still is. She's still there. It's awesome. They now have coffee and tacos. It was always surrounding tacos. But I would say that the average person is like, oh, the reason she's successful is because tacos are so popular. No, it's because she understood that it took 2 years to become successful in the restaurant business. So I think about that a lot when people get started, because they always end up saying, well, nobody likes my blog, and they quit after 6 months. And the stakes are much higher here than a blog. So consistency and long-term.
That's fantastic advice. A couple things struck me just as they relate back to Cambia Grove. So comments about the need for solutions to have a problem in mind and impact as the goal. That's something that we really stand for here at Cambia Grove, and something that actually is factored into the judging process for the trails competition. So I love that. And also, as I mentioned at the top of the call, infrastructure, incentives, and culture, those are the three elements that we think are really critical, not only to improve, to drive healthcare transformation, but also to think about. So it's really important for innovators to be thinking about, who's going to pay for it? What's the data system that needs to be integrated? How long will it take to become, stable? These are really important considerations. Thank you all for sharing those. Okay, so the next question here is for you, Samantha. Given, and of course, Gabe and Julie, please chime in. Given MultiCare's reach across the state in multiple communities and across geographies, we would love to hear your perspective on how we can ensure that behavioral health services are inclusive and equitable for all populations and regions.
Yeah, so full transparency, I don't think that we're there yet when it comes to really ensuring access and equity. I think we have a lot of room to grow, and I want folks to know that. I'd be the first to say our services are not all inclusive. They're not equitable. They're not nearly what they should be, but that's the beauty in having a continuous process improvement lens towards growth. So while we're not there yet, I will say, just in the past couple of years, we've done things to improve access, like going digital, like having digital services for individuals in rural communities. We've mobilized some of our services. So for folks that struggle with transportation, maybe live in an area where there's not good public transportation, actually physically getting out, having mobile clinics driving around has helped. We do have some translator services, but they're not as widespread as they should be. And so I think for us, while we've utilized some mobile and many digital solutions that help our reach, the future looks very different. We need more clinicians, more people with lived experiences working for us. We need more individuals who have English as their second language or speak different languages, and who represent and reflect more of the communities that we're trying to serve. We need to continue to strive and push the edges of our reach by working with even more remote populations, and to do a heck of a lot of listening. I don't think that it's myself or my leadership who really have the answer. We need to listen to our communities. We need to be humble and inquiring what it is we need to do to meet them where they are, and probably do a lot of education on what mental health is, and that it's okay. It's okay to want services and to need services, to address that sort of systemic bias and stigma around our field. So I don't have a succinct, short, well-thought answer, but I do know that the answer lies in folks like the panelists here, the people who are in our virtual room, and for the individuals that we're all trying to work together to serve.
I'd love to throw in just a couple of comments as well. Samantha, I think you did such a good job articulating a lot of the work that is ahead of us. I think all of us are trying to do this as well. Samantha talked a little bit about how digital is critical for scaling, and I'll just kind of emphasize that. We're not going to solve this problem all with people. And so coming up with really smart ways of applying technology to help support, whether that's as an adjunct to in-person care, if it's filling in gaps, if it's starting with low acuity, if it's helping support navigation between kind of stepped care, there's tons of opportunities. So think about how technology can scale to support that. Also, a lot of the solutions don't need to help everyone. Sometimes they can just help groups that are currently falling, maybe there were gaps of care, maybe where they're falling through the cracks. And the best way, Samantha said this, I'll just re-emphasize, but and I talked about it earlier, listening to the patients, getting out into the community, talking to diverse populations and really hearing from them what they need. We did a really interesting partnership with an organization called Grapevine Health. And one of the doctors there did a listening session where she stopped people on the street and talked to them about their mental health. And it was fascinating to hear what they had to say, some of the stigma that was coming out, and also how they use different language than we did. If we're going to be patient first, we have to say things in the language that people understand them in. And I think that's another kind of thing that I'll throw out as well that hasn't come up yet, is that we know that health literacy is low in our communities. And often as, innovators, we're coming from health systems, we think about this all the time. I spend a lot of hours a day thinking about healthcare, and I have studied it. And that is not where most people are at. Most people don't have great vocabularies around this. They have very varied conceptions around mental health. And so being really thoughtful about the level of content and how you communicate with patients so that they can really understand and get what the services are is really important. So we'll just throw that out there.
I would like to say that patients are starting to be aware, and especially patients in largely marginalized communities, they're starting to be aware that the thing that was made was never made for them. And now people are like, oh, that thing doesn't work for you? Well, that's shocking, even though we never tried or looked or considered it at all ever. So there becomes this like retrofitting idea. Like, okay, well, we'll take this that we already have and we'll somehow make it work for you. My grandfather's an engineer, and he is very fond of saying that retrofitting is just a fancy way of saying that I made a mistake. I made a mistake and now I'm going to fit it, or I'm going to fix it. But rather than saying I made a mistake and now I'm going to fix it, you say I will retrofit that. And people hear, oh, he's going to do engineering stuff. That's awesome. But in actuality, somebody made a mistake. I think that a lot of our processes were never made to consider some of the people, many of the people who they are being used for or in conjunction with. So obviously we can't change the past. We can't go back. So retrofitting is a very good idea for the mistakes that we've made in the past. But as we innovate to the future, don't make that same mistake. Don't just ask yourself, is this good for middle-class America? Or is this good for people with insurance? Or is this good for major populaces? Also ask yourself, is it good for somebody with no money? Is it good for marginalized communities? Is it good for rural communities? Will this solution work for everybody? And then, to Julie's point, sometimes we will miss some people. Nothing can ever be 100%. I want to be a realist in all of this. We can't create one thing that works for everybody. But I have to tell you, if somebody invented something and said, look, this is going to work for this group of people, these 90%, I don't have anything for this 10%. Do you know how far ahead we'd be? We'd know from jump who we need to target and correct, and then get it released for the other. And this would just be such a great trend versus I have the solution, here it is. Oh, there's a group complaining. They complain so much, don't worry about it. And then finally, after years of problems, somebody's like, well, they slipped through the cracks. They didn't slip through the crack. There was no crack. They were ignored. So I think that we have to learn from the past, retrofit those things. But the next time we build a bridge, let's make sure it's perfect from jump. That would be excellent. Sincerely.
Wow. Yeah. Thank you. Great comments. Yep. Julie, go ahead.
Julie, I was just going to add one more thing, which is there are tons of organizations that are working to think about these problems. They're not new. And I think in the last, this has been a problem for a while, but often there is a challenge of not going directly. I keep harping on this, but not going to the communities, not going to the organizations that are already working within the communities. Partnership is such a critical component, and don't think that you can come in and just magically start over. Leverage the resources that exist, leverage the learnings, attribute the work to the people in these communities that are missed to really help here. So, you don't need to start from scratch. There's tons of groups that are starting to do this and maybe just need extra support to amplify that or to integrate the learnings into solutions that are being created. So think about partnerships, think about where you can derive learnings and kind of build on what's already been happening, because that's where we're going to get the most impact.
Yeah,
I want to quote my
absolutely.
grandfather again, just because he's already made an appearance once. That's called "Don't reinvent the wheel." He has taught me many a life lesson. Very, very practical man.
These are fantastic insights. And I would just say, Gabe, as you're a judge, this is the exact lens that we would like you to apply as you're assessing the solutions and thinking about who should advance to, the 5 finalists and all the way to the grand prize. This is the filter we need you to apply. So thank you all for your insights there. Okay, so speaking of the competition and the prize, one of our last questions here before we eventually get to audience Q&A, and I see that there are lots of great questions coming through there as well, so I'm excited to get to those. For Samantha and Julie, and then obviously Gabe, for you as well from an outsider perspective, but we'd love to hear from you as the grand prize partners. What components of the prize are you most excited about? And what do you think will be most beneficial to the innovator community?
The most beneficial part of this for participants is the exposure to real world people, to really get traction. I'm sure this is true for Julie. We've seen so many passionate, capable people with really novel products that just kind of glide off the surface and never take root and develop and grow into something meaningful. And I wish that I could put all of those folks into this competition so they had more of that exposure to help them and help their product. So I think that alone is just phenomenal that the folks who are participating get that exposure. Selfishly, I know this is the same for my team, but we're so excited, to be meeting with panel or to meeting with participants, because you all are tremendously capable of bringing us hope, and not to sound, defeatist, but healthcare operations, you're constantly putting fires out at your feet. You're constantly thinking about the today and the now, and how do we, meet our budget, and how do we survive, or how do we deal with workforce shortage? And we don't always get to look beyond, to look out at the horizon and what's developing, what's new, what's coming. And so for us, just getting to meet with you and hear your ideas and foster that however we can, it's this bright light that we get to enjoy. And so I'd say that's probably what I'm looking forward to the most, is just this thrilling opportunity to hear what capable folks are thinking for our field.
Samantha.
Yeah, and Samantha, I think I echo so much of what you've said already. So often smaller, earlier innovation fizzles, and it's really challenging, admittedly, when you work, I work for a very large health system. It's hard for us to support newer innovation and help foster that. And so Providence is really excited about the opportunity to support that in a new way, because we really want to see the outcomes of this. We want we want innovators to come forward and keep moving things along. And the prize package that we pulled together really targets a lot of the pitfalls that I shared earlier. So often early organizations struggle around things like funding. And so we've gotten a commitment from someone on our ventures team to help talk about business model and how you raise funding and how you approach some of the kind of business model challenges. I talked about not being able to clearly articulate what your solution or service is doing. Well, we've got go-to-market experts who help us think about how do you communicate what you're trying to do, and shaping the story around what you're doing. And so really excited. We've got so many amazing healthcare executives, behavioral health executives who are really excited to share what they have been learning. And I think, so often companies are not, is it Wayne Gretzky who is always trying to skate to where the puck is going, not where the puck is at. We know things are changing so much in healthcare right now. By talking to some of these healthcare execs, you'll see not just where behavioral health is going, but where healthcare overall is going. Where are hospitals? What are we thinking about the fact that operating income is down pretty much across the board, that the payer model is completely changing because of the shifts last year. So there's a ton. And so we're really excited to bring in both behavioral health as well as general system and strategy leaders to talk to you. And so then we've also got, we have a whole team of strategists that think about how do you evaluate companies so that we might pilot in the future. And so I'm excited to share what we've learned about how we evaluate companies and how you look at the data and the value stream that companies are trying to put forward, which is how we consider whether we might bring someone into our system to work with our communities or our patients. So lots of great resources to help tackle those pitfalls. And I know all of them are excited to help keep pushing the innovation forward.
And first off, I completely agree with what everybody said. It's awesome to see the winner, right? I mean, and look at what they do and where they go, and it's incredible. And I don't, what I'm about to say should not dismiss or diminish that in any way. But there's that story of the basketball coach that cut Michael Jordan. And everybody talks about it like that basketball coach did something wrong, like he was stupid for cutting Michael Jordan. But I've always heard that story to believe, and again, I am not Michael Jordan, but Michael Jordan got cut and he was like, okay, what did I do wrong? What do I have to fix? What do I have to do to get back on track, to whether it's to prove that guy wrong or make that guy proud? That's a personal decision, and you can, wherever you land, you land. I sort of want to see the person who we judge and we think, it's just not all there. There's not enough. But by entering this competition and by working themselves out, by submitting it, they learned something. They figured something else. They met something, or they met someone. Do you know how many like famous partnerships where I had this, and then we were at a tech conference, and then we had this, and now it's Apple. I'm sort of excited 5 years from now for somebody to win this thing and tell us the story of how they lost for 4 years in a row, but they learned a little more each time. I think that it's exciting to win, but I think it's also very exciting to figure out why you didn't. Because that gets you closer to your ultimate goal. And since we're doing Wayne Gretzky, you miss 100% of the shots that you don't take. Very famous quote by Mr. Gretzky. So keep entering until you win, and keep learning. I really don't like lose. I like didn't win yet. So that is my advice to everybody. Sincerely, like 10 years from now, I want somebody to be like, yeah, Gabe said my thing stunk and now I'm changed everything. And I'm like, you're welcome. I mean, that's incredible. And I sincerely hope people take that to heart, because we can learn so much.
Fantastic. Yeah, and we at Cambia Grove are also just extremely excited about all parts of this competition, about, the judging process, the 5 points tour, the grand prize. I've seen a couple of comments and questions in the chat and in the Q&A box about just the details of the prize and what that will consist of. And I think Julie and Samantha, you talked to it a little bit. Our team will share the FAQ page link in the chat so that you all can see the details. But at a very high level, as I mentioned at the very top of the hour, and I know that some people didn't have the chance to join right away, but it will be a series of extremely valuable conversations, workshops, informational interviews with people from across the system. We have strategy, clinical, operational, and venture partners lined up. And I think another important element here is that the details of that and the specifics can be tailored to really meet the needs of the winner. So it can match where the company is, what they're focused on, And we're so excited to just see what that looks like as we identify the winner. Okay, so we've got just a couple of minutes left before I do want to open it up, or actually just go through this long list of great questions that have already come through. So the last question for each of you, and how about this? We'll start with you, Gabe, is any final words of advice for innovators? And I think what I'll just say to frame it up is that we've got folks on the call today who likely, are considering applying for the Trails competition. We also have people from, throughout the healthcare system who are interested in the topic. And so just in general, what might be your final words of advice for innovators in this critically important space?
In many ways, I'm terrible at giving advice, because the best advice that I have is to just do it. I sincerely just do it. Don't let perfection get in the way of progress. I spent so many years afraid to put stuff out in the world for fear that I'd get it wrong or that I'd make a mistake. And when I finally got over that fear, after years and years of work, when I finally went out in public, I made all the mistakes. I made every single one of them, embarrassed myself, embarrassed my mom. It was terrible. So all of that preparation did nothing, but all of that failure did everything. It changed everything. It made me a better interviewer, a better podcaster, a better writer. But sitting at home waiting until I was ready did not make me a better anything. So if you're on the fence, just do it. Just absolutely do it. If you're a hard no, maybe get on the fence and then remember the advice I gave the people on the fence. Just do it. I really don't think that there's any harm in trying, and you will learn a lot of information from incredibly intelligent people who are in your sphere, in your space, and then you can use that information to decide what's best to move forward. So the advice that I have is, don't let perfection get in the way of progress. You could be sitting on literally a life-changing idea. So get it out in the world.
Thank you, Gabe. How about you, Samantha?
Yeah. Odd fact, I guess, about me is I don't usually read the self-help books and sort of inspirational books that are meant for adults. I instead turn to kids' books. I think that they're a lot fewer pages and a lot less words, and often have just as good a message. And the one that comes to mind when I think about what you all are endeavoring to do is called 1,000 No's. And essentially, you on this journey, whether it's the next few months or the next few years, you will get 1,000 no's, just like Gabe shared. But each of those no's is a building block. Each of those no's is something that you can overcome and piece together and ultimately use to create that one big yes, where an investor, a healthcare partner, a purchaser says yes, and all of those 1,000 no's will be worth it at that point. So just remember that it might take 1,000, and like Gabe said, get started. Get like 5 or 6 in the next few months. Start piecing that yes together.
Thank you, Samantha. Go ahead, Julie.
Yeah, I think that if I were to give one piece of advice, it's that you shouldn't shy away from the really hard problems. So often we see innovators moving away from the thing that needs to be solved because it's hard, and towards things that are, the really clear, easy business model. And that means that all of the innovation is getting funneled to solve like this little bit, when like this is really what we need. And so like my ask is, we have so many things we want to tackle in our system. We like the list of priorities is so long, and yet a lot of them, like, they don't have solutions because people are shying away from those things towards where the easy solution is. So try for it, really go after these things. I know that they're hard, but there are definitely solutions. There's ways to tackle them. We are here to support and be resources to work through those, and really to partner, because I think all of us win when we solve the really big things. So definitely don't get scared away. You don't have to gravitate towards the lower acuity side of the spectrum. We've seen solutions work across the board. We've seen solutions work in all kinds of different spaces. And so, stick with your convictions, go after what you're really seeing as the big problem, and we're here to support you. So I'm excited to help in any ways that we can.
Thank you. And to our audience, now you see why we chose these folks as participants in the grand prize, and also along the way, obviously. Fantastic. Okay, so we've been getting a lot of really good questions. It's going to be hard to choose. So I'm going to go with the one that I see that's most recent. I'll start there, and then we can get through as many more as possible. So this question, I think really could go to anyone, but maybe I'll start with you, Samantha. It gets to a question that you answered to start earlier. Do you have any advice regarding how innovators should think about scale when there is so much evidence that differentiated approaches work best to address a common problem across diverse populations?
That's a really tough one. Scale to me means a few different things. And so I don't know if I'll answer with what the person who asked this question had in mind. I think in terms of scale, it's important to question what your dependencies are. Is it workforce? Are you researching the different workforce opportunities or shortages out there? What are the other opportunities? Like partnership is one. If you're struggling to hire the workforce that you need to scale, how then can you partner, or how can you bring on another tool or resource to make even more of the efficiency that you have today? I don't think that's an easy one to answer. I think often you come up with challenges for scale and you just have to research and dig deep. I think there's an answer for every problem. There's a solution. And I know that scale for us is incredibly challenging. And I think the area just personally that we found the most success in scaling is by partnering. So again, don't overestimate what you can do in this, but don't overestimate what you can do with others. And so I'd say maybe that's a key that folks should keep in mind as they build, is how your product and your solution plug into other things so that you can achieve that scale and maximize together.
Yeah, that's great. Thank you, Samantha. And Julie, go ahead.
Yeah, I'm happy to layer in too. I think if I heard the question, one of the pieces that came in is basically, how do you, people need different things. How do you kind of scale a single thing? And the reality is that we're not scaling single things. We're scaling a whole bunch of solutions that we're pulling together into an integrated offering. And, as Samantha mentioned earlier, I've alluded to this, we're working on it. We haven't gotten to the place where we have the true comprehensive digitally integrated system, but at least at Providence, we're really building on those pieces of pulling together different technologies, of bringing in orchestration and infrastructure technology to help support navigation and personalization, so that you really can target and find the right thing for the right patient at the right time, no matter where they're coming in. So your solution doesn't have to solve everything. We've got other technologies, we've got other vendors that are coming in. Solve what you're trying to do really well. And then while you're scaling that, if you're able to target more things, fantastic, that's great. But you don't have to solve every problem. If you can solve a problem really well, there's a lot of opportunity for traction and a lot of opportunity to bring that into larger health systems. So don't I wouldn't shy away from something assuming it's not possible, because it's definitely possible. We've got lots of good tech, and honestly, there's a lot of work happening to partner between health systems right now, so that infrastructure that I'm talking about can be leveraged, because this is such a priority for so many groups. So to tackle the thing, do it really well, and we're going to be right there with you to help think about how to bring that to scale in collaboration with the other tools we're using.
Yeah, fantastic. Thank you. Okay, so a couple more questions have come through. I think one that I will choose to talk about is because it will help, I think, zero in on the solutions that would make sense for applying for this application, for this competition. What would you say are the biggest headaches in behavioral health care? And then this was a second question from the same individual, and I think it relates, is thoughts on tracking outcomes in this space as well. So biggest headaches and how do we track the outcomes to address those headaches?
I think the biggest, from a patient perspective, which is going to be vastly different than from a provider perspective, the tracking outcomes is probably the biggest headache. There's really not a lot to track outcomes. Somebody goes to therapy for 3 years, and if they do well, that's a great therapist. If they do poorly, they weren't working the steps, they weren't trying, we really do sort of have this in behavioral health where if the person gets better, we give all the credit to the therapist and if the person or the provider, and if the person does poorly, it's their fault. And we really don't have a way to tease that out. I would be very interested in a way to track that, because we do have that in other things. I mean, in dentistry, could you imagine, a dentist that failed at every single root canal? That would get picked up on. But if we had a therapist who every single patient did poorly, I don't think anybody would notice. And that may be an extreme example, but I'm kind of going to stand by it. I think that a therapist could probably operate for an entire career and not have a single person get better and go completely undetected and undeterred. And that alone should be frightening, because from a patient perspective, there's no way that I can sincerely ask, hey, are your patients getting better? Because they're just going to say yes. They're just, and there's no way to prove it. I don't know what that looks like, though. It almost sounds like fantasy. How do we track that? Again, I'm just a judge.
I'd weigh in. So I'll go backwards. So starting with tracking outcomes, and this ties into how good of a clinician are you really? There's a lot of evidence-based material out there for assessing severity of a menagerie of different symptoms. Our industry is not very good at using those often enough to actually give us data on how well or not we are helping manage those symptoms. So I think if you want data, use the scores over time in evidence-based materials and use them in often intervals and have it in your EHR and have your clinicians documenting it and having management over your clinicians whose patients aren't getting better based on those outcomes. Like, that's a nice foundation to start. Is Epic or any EHR doing that super well right now? No, but we're working on it. I think other pitfalls are reimbursement. I don't know of many parts of the healthcare industry where you can have an MD working in almost any hospital or outpatient environment whose revenue does not cover their salary. I mean, we are at a loss with almost every clinician kind that we have due to reimbursement. And I will be the first to say, I think that's due to some systemic stigma in the healthcare industry and maybe, payers and government as well. So addressing that and workforce, it's a hard field to go into. I'd love to see us be able to pay clinicians more, psychiatrists more. I'd love us to be able to do more in terms of, services that are free of cost. I would love for us to see just some ingenuity there so that people who dedicate so many years of going into college actually feel like they've got a career that pays the bills and is fulfilling where there's growth opportunities. And another, pain point is access. For all of the reimbursement and workforce shortage and all of that combined, it should not take somebody 30 plus days from requesting therapy or behavioral health services to getting it. I think that we are letting people languish. I think that we're letting people die. A lot of folks who are experiencing some dark stuff out there. And by making people wait, I think that we're really harming them. And so I'd love to see us improve the timeliness to access and the range of our services.
Yep, fantastic.
Oh, it's hard to talk after both of you because you've brought up so many of the hot topics that really are things that keep me up at night. So I'll throw in something completely different. We'll just call it an oddball thing. But one of the things I've been thinking about a lot lately, specifically with regards to technology, is how do we do a better job of engaging our patients so that they stick with treatment? We see so many patients who so they don't even make it to the place where they actually follow through on a referral. So they don't even set up the first visit. They do set up the visit. A lot of patients don't go for another. And we know that, there's many people for whom that is going to meet their needs, but many will not. And so how do we, whether that's for in-person services, but the thing that I think about and what keeps me up at night is a lot of the technologies that we have. So often the tools are focused so much on the clinical content that they don't actually build in the components that need to be managed to keep people coming back. And so we need to build in engagement through these services. If people won't use them, they don't help. So how do we layer in these extra components to make it easy for people, to make it engaging for people, to feel like they're actually getting better, because that's really what keeps people using the tools. So I wouldn't say it's like the number one thing that I'm thinking about. A lot of those things have already been talked about, but it's something that is so critical as you're innovating and thinking about new solutions and things that you're going to build. You've got to keep people coming in, or else they're not gonna, if people don't use it, it doesn't help. So I'll add that in. And then just to throw in a last comment on outcomes, this is something that is evolving. It's really challenging. I mentioned that we're in 7 states. We've got multiple Epic instances. It's very hard to be tracking, and that doesn't mean that we're not working on it. And so the thing that is really helping us right now is starting to automate. So how do we trigger and create this so that, our clinicians have too much on their plate right now? And how can we take things off and do it for them in a way that really helps? So can we track outcomes without requiring, that to happen? So we're doing a lot of work to try and do depression and anxiety screenings ahead of all primary care visits, to follow up, to make sure that we've got that we're tracking those patients over time, that we've got the staff to be able to catch when someone is declining and proactively reach out and get them the help that they need. So the outcomes, it's a hard piece. There's no fast solution. The data management in a healthcare system is so hard, but it has to happen. We will not be able to keep doing the work we do if we don't start showing demonstrable outcomes. And that's going to be especially critical as we shift our business models. So right now, everyone is talking about value-based care. It is likely a slow transition for many of us. I know not for everyone. Many are in a luckier situation. But the reality is, payers aren't going to make those transitions, and we're not going to be successful with those new business models unless we're tracking outcomes, unless we're showing that we actually are making a difference with the care that we deliver. And so, we might not have the answers, but we have to get them, and we have to get them quickly so that we can continue delivering high quality care to everyone.
Julie, thank you. That's fantastic. And you actually touched on a number of the questions that we unfortunately won't have time to get to. So you touched on value-based care screening. Thank you for chiming in with that. So we are unfortunately out of time. I wish we could get through so many more of these questions, but hopefully we answered many of them just in the responses that we were able to hear. So in closing, I just want to thank you again, Gabe, Samantha, and Julie, so much for participating in this year's Trails competition and joining us today. And also thank you to the audience for your attendance and your participation. So I am thrilled to announce that as of right now, the application for the 2021 Trails competition is officially live. The link to apply is in the chat right now. Thank you, Laura, and will also be shared in a follow-up email along with this event's recording. Please find us online, take a look at the details of the Trails competition, and if you think you're a good fit, apply. Deadline is October 31st, and we can't wait to see your fantastic solutions come through. So with that, I'd like to say one final thank you again to our speakers and the audience. We look forward to remaining connected with you throughout the remainder of the competition. So please do stay tuned for updates along the way. Thank you, everyone, and have a great rest of your day.